Welcome to Dr. X, where you learn why asking questions and taking responsibility for your own health saves your life. In today's episode, we'll examine hospital staff and nurses who get high and drunk while on the job. If you're like many Americans, you've probably had to visit the hospital or ER during your lifetime. Things happen in life, and sometimes you require immediate medical attention. Some of these problems could be minor, such as a sprained ankle or a bad cough that you want a doctor to check out. But imagine if the problem were life-threatening. Say an elderly parent or a young child needs instant medical attention. Maybe it's a severe injury or an extremely high fever or even pain in the chest. Well, if you're like everybody else in the United States, you'd call 911 right away, expecting an ambulance to show up within minutes with an alert, well-trained and professional staff to rush you to the nearest hospital, right? Now imagine that ambulance shows up a bit late and the driver stumbles out of the driver's side door and is so drunk he can't even drive. Or imagine you called the ambulance at 3 a.m. because your loved one is having scary pains in the chest. The ER night staff was getting stoned before you arrive. They seem obviously impaired. What would you do? Would you let them see your child, taking the risk that they could make critical mental errors that could contribute to the death or injury of your child? Unfortunately, shocking scenarios like these have played out at hospitals across the country. It's more prevalent than you may think, and I'm here to help you avoid this horrific situation if you ever encounter it. Let's envision you're the parent of a beautiful baby girl 6 months of age. Upon birth, you are told that your baby girl has a slight irregular heartbeat that should be monitored, but it doesn't pose any immediate threat. After enjoying your newfound life of being a parent and dealing with the sleepless nights that accompany that, you notice on one particular day, your girl is very quiet and not crying. After calling your primary care doctor, he assures you all is well and not to worry, but to certainly watch her at night while she sleeps. Unable to shake your nagging feeling as a parent, you check on her at night, and to your horror, her breathing is so slow, you thought she was still. You panic and call 911. The ambulance arrives, and the EMT declares that your baby's symptoms are consistent with a heart condition. Relieved to be under professional care, you hop in the ambulance, and upon arrival at the ER, you notice some of the lights are off, and the staff is somewhat loopy. As the nurses and doctors approach the ambulance, you swear you can smell alcohol in someone's breath, but you're not sure. It doesn't seem possible, and you're so worried about your baby you dismiss it. The EMT gives the doctor his initial assessment, and to your horror, the doctor says he needs to operate immediately. As they whisk your baby girl away, you notice a nurse laughing. She actually has the giggles. You're confused, enraged, and panicked. To make matters worse, you notice the thick scent of alcohol, even in the hospital's corridors. Your baby girl lives. In fact, she's fine. But you find out that the whole hospital staff, including the ER doctor, was drunk and high. By sheer happenstance, another doctor had left something in his office and noticed the negligence and criminal behavior happening and demanded to operate on your baby girl himself, knowing that the on-site doctor was too drunk to perform the operation safely. He saved the girl's life. Think this is fictional? Think again. Consider this case in Oakland, California, March 26, 2006. A neurosurgeon had to be wrestled to the floor by sheriff's deputies outside an operating room after he threw a fit because he had to wait for instruments to be sterilized. The deputies said the surgeon was drunk, and a nurse reported smelling alcohol on his breath. The doctor had insisted that a trauma patient needed immediate attention and urged staff members to skip the 2-hour procedure to sterilize the equipment, which had been borrowed from another hospital. 2 other surgeons, however, had determined that the injuries were not life-threatening. The brave and honest nurse refused to let the surgeon operate with unsterilized equipment, and an outburst ensued. A witness heard the surgeon say, "I'm an expletive doctor and I'm going to do what I want." The surgeon threatened the nurse and later took a swing at deputies who were called to intervene. It took 3 sheriff's deputies to subdue that doctor. The surgeon was arrested and briefly jailed. His hospital privileges were suspended, pending investigation by the hospital, the California Medical Board, and the county. The patient had the surgery performed uneventfully the following day. I bet you're hoping there's some way to find out about these incidents, to see whether your local hospital has experienced similar problems. Good luck. Hospitals go to extraordinary measures to hide these incidents, so obtaining accurate information about incidences of drunk or impaired staff on the job is difficult. Even when it's abundantly clear, hospitals will attack the accusers or simply declare that such problems are isolated incidents, laying blame on one staff member rather than openly admitting it as a bigger problem. After all, lawsuits are expensive and bad publicity, and public outcry hurts the hospital's ability to fundraise for research projects. So hospitals have ample reason to hide this epidemic and ensure their money source and profits. That's all for now. I'm Dr. X.